Welcome to the Ask Dr. Khan show. This is Dr. Peter Khan, functional medicine doctor. And on this show, you're just one whiteboard away from solving your health puzzle. Now, today, we're going to continue our conversation with thyroid. So, now, the conventional way of how thyroid is diagnosed is very insufficient. Okay, so you show up to your doctor's office, you complain of thyroid symptoms, you complain of fatigue, weight gain, hair loss, cold hands, cold feet, dry skin, brittle nails, constipation, depression, brain fog. See, these are all symptoms that could be associated with having thyroid issues. Now, the medical model, the conventional medical model of thyroid management is very insufficient. Okay, it's too simplistic. So basically, they wait for you to have very obvious and severe thyroid symptoms. Once you have symptoms, then what they'll do is they'll test pretty much thyroid stimulating hormone, TSH. This is a marker that's actually not even a thyroid hormone. The TSH is actually a marker that measures pituitary function. It's a pituitary gland that makes hormone that stimulates the thyroid to tell the thyroid what to do. So this is not even a thyroid hormone. So testing TSH by itself in isolation without other thyroid markers is insufficient to actually diagnose a thyroid problem. But that's what's the conventional model, right? The conventional model of thyroid management is they test TSH. And based on this, if the test is high, right, if your TSH is high, that will indicate low thyroid. So it kind of goes the opposite direction. High TSH indicates low thyroid or hypothyroidism. Low TSH means hyperthyroid. So basically, once you have high TSH, then you get diagnosed. You get diagnosed with what? With hypothyroidism, which may not even be the root cause of your problem. But here's your diagnosis. So then what they're going to do is they're going to give you thyroid hormone replacement. Now, this thyroid hormone replacement could be Synthroid, could be levothyroxine, which is generic for Synthroid. It could be the bioidentical source of thyroid hormone, which would be Nature-Throid or Armour Thyroid. There's also Cytomel and Tyrosine, all various different type of thyroid hormone replacement therapy. Now remember, these medications are exactly that, thyroid hormone replacement. So a lot of people come to me and say, hey doc, I'm taking thyroid medication. I got to take my thyroid medication or my thyroid's not going to work. Just so you know, the thyroid hormone replacement does nothing to stimulate your own thyroid function. Thyroid hormone replacement is to replace the thyroid hormone that you would have made, but you're not making enough, so they say. So you're getting this replacement, which this medication, Synthroid levothyroxine, does not heal your thyroid, does not make your thyroid work better. It doesn't do anything. In fact, it has a potential to shut down your own thyroid hormone production. Anytime you take a hormone from an outside source, you risk messing up that negative feedback loop, which can actually shut down your own hormone production. So thyroid hormone replacement does nothing to heal your thyroid. It just replaces thyroid hormone that you may be deficient with. Okay? So then what happens after you get the thyroid hormone replacement? Well, you get follow-up visits. Follow-up visits, right? Every, 3 to 6 months or even up to a year. So you get follow-up visit. And what do you do in the follow-up visit? They recheck the TSH. If you're lucky, they check your free T4, free T3. Sometimes not all of them. But remember, TSH by itself is not enough to tell whether you have a true thyroid problem or even what type of thyroid hormone dysfunction. So then you go back to this, and then you get diagnosed with more hypothyroidism, and they adjust your medication dosage. You come back for follow-up in a year, and then you just repeat the same cycle. So your hormone level go up, down, up, down. They say, oh, your lab test is looking good. We'll keep the same dosage. Or your lab test doesn't look so good. We'll up the dosage or down the dosage, up and down like a roller coaster. And your symptom never really changes. You still feel crappy, you still feel fatigued, you still feel hair loss and can't lose weight and brain fog, all the same, even though your lab test is normal. Put in the chat box if you have that experience that, yes, my lab is normal, but I don't feel normal. Put in the chat. Go ahead. Just so you know how many people have this problem. All because this medical model is failing many of you. By just getting hormones without addressing the actual root cause, the root cause is ignored in this medical model. This is why so many of you don't feel well. Now, what's the other scenario? The other scenario is, let's see if we can erase this here. The other scenario is that your test is normal. They test your thyroid. Remember, when they test your TSH, that's not testing your thyroid, right? I just mentioned several times on this video, that's a very incomplete test. And this test doesn't even test your thyroid function, it's testing your pituitary gland function, right? But let's just say this test came out normal. So guess what? They say, well, doc, my test is normal, but I still feel lousy. So guess what happens? Now they're treating your symptom. They treat symptoms without looking at the root cause. So how do they treat the symptoms? They give you antidepressants, like Prozac, right? Because you say you're depressed. Well, you have all these symptoms of fatigue, brain fog, hair loss, constipation, all these thyroid symptoms, but your thyroid test is normal. You must be depressed. Here, take antidepressant. I mean, does that make any sense? I mean, when it makes no sense, you have to question the narrative. More than ever, you need to question the narrative. Okay? Ask questions. Don't just take it like a sheep. Okay? Or they'll treat with anti-anxiety medication. Oh, you must be anxious. Oh, doc, I can't sleep. You can't sleep because you have thyroid. You have a hyperthyroidism. You have Hashimoto, so your thyroid hormone's going up and down. That's why you can't sleep, but they don't know that. So they say, oh, you're anxious, you can't sleep. Here, let me give you some anti-anxiety medication. It'll help you with sleep. It'll help you with sleep. What's causing the sleep problem? We don't know. Just take this drug, right? You need to start to advocate for yourself. Do what's right for your body. Do the right thing for the right reason. I've always said that for the past 10 years. Go back and watch my video. Do the right things for the right reason. Don't go for short-term gratification. Do the thing that's going to give you long-term outcome. And you can't just treat these symptoms and expect whatever's causing those symptoms to just fix itself, because usually that doesn't happen. Or they give you a hormone. They give you birth control even. Oh, your hormones all messed up. All the symptoms you have that look like thyroid symptom must not be the thyroid, because your thyroid test is normal. See my quotey finger here? Normal. Must be your other hormones. Let me give you some estrogen, progesterone, testosterone. That's what happens, and you don't feel better, right? And on and on. That's the conventional medical model, and it ain't working for most of you. If it's not working for you, put it in the chat box. Not working for me. Go ahead and put it in the chat. It's not working for you, because you need to speak up. This is your chance to tell me, you tell yourself, so you're hearing it, that it's not working. And hopefully that'll spur you on to look for the right solution. So let me share with you what the right solution might look like. So here's what are some of the different management. So number one, you must understand, what are you treating, right? When you have thyroid problems, thyroid hypothyroidism, let's just call it that, hypothyroidism, right? Low thyroid. Number one cause, the number one reason is due to Hashimoto's. That's the first thing you got to recognize. Now, when you have Hashimoto's, you must recognize that Hashimoto's is an autoimmune disease. It is not a thyroid condition. Although that's not what your doctor will tell you. They say, oh, you have Hashimoto, you have a thyroid problem. No, you don't. You have an autoimmune disease. Therefore, treating the thyroid with thyroid medicine, right? Thyroid hormone replacement, thyroid medications, is not the solution. You got to treat the autoimmune component of this disease. That's the first thing you got to recognize. So what's the actual management for Hashimoto's? Well, again, we have different models. We have the medical model, which is, as I talked about, they check your thyroid hormone, TSH, and they give you meds, and they treat symptoms, right? Depression with antidepressants and so on. Okay, and then we have the people who are going for the alternative medicine. And what do? Well, then they take supplements. They'll take iodine, which is actually very bad if you have Hashimoto. That could potentially flare up Hashimoto's. Potentially. Okay, so you need to know that. Or you're on a quest, right? You're on a search for the perfect hormone. You're on a search for the perfect hormone replacement therapy. Oh, if I can just switch from Synthroid to Armour, I'll just do much better. If I could just switch from Armour to Nature Throid, I'll do much better. Or if I can go from 0.95 microgram to 0.115 microgram, I'll do much better. Why can't my doctor just give me more? You're arguing about dose, you're trying to find a perfect dosage of these thyroid drugs, or you're trying to find a perfect drug for you. That's not even in the neighborhood of what's actually happening. Remember I said, when you have Hashimoto, it's not even a thyroid hormone problem. Therefore, thyroid medication, like these things, is not going to work. You need to address the underlying cause. So this is what most people do. They get stuck in a medical model, or they go to some natural alternative doctor who just give them iodine and give them these, different alternative, or even thyroid supplement. I don't care what it is. If you're trying to treat the thyroid, it's not going to work, because the problem is not the thyroid. The problem is autoimmune. So let's talk about then, how do you actually address this? What's the right way to do this? You actually get long-term results. That's the most important thing. So when it comes to the proper Hashimoto's management, the number one thing you got to look at is the trigger or triggers. That's the most important thing, right? You got to find what's triggering. Why is that important? Because when you have Hashimoto's, remember, it's an autoimmune disease. That means your immune system is attacking your thyroid in this case. But remember, once you have one autoimmune disease, you can have multiple autoimmune disease. And when you have an autoimmune disease, the trigger is what's triggering the autoimmune flare-up. That's what's triggering the autoimmune flare-up. So the game is not finding the perfect thyroid hormone replacement. It's not finding the perfect dosage of your thyroid replacement. It's not taking a bunch of drugs. It's not even about taking a thyroid supplement. It's about finding the trigger. That's the proper way to address Hashimoto's. So what are some of these triggers? Could be diet. Basically things you put into your mouth. Could be lifestyle. Could be chemical toxins. And can be microbes. These are the four major things that you got to look at. Okay, there are other factors, but these are the major things that you have a lot of control over. More control than you think, with the right help. So diet-wise, we're talking about gluten. It could be dairy, soy, corn, egg. These are the major ones. Doesn't mean you're sensitive to all of them or any of them, but gluten for sure is very common. Dairy is also very common. It could be grains, or it could be other lectin-containing foods. Another thing is iodine, I talked about earlier. If you take iodine supplement, you're asking for trouble when it comes to Hashimoto, because it can flare up an autoimmune disease, especially Hashimoto's. If you take too much salt, high sodium diet. Sodium has been shown to be a trigger for the T helper 17 pathway, which triggers the inflammatory pathway of autoimmune disease, especially for Hashimoto's. If you eat GMO foods, what's the problem with GMO? Well, specifically, it's glyphosate. Glyphosate is the chemical found in the pesticides. And GMO foods are sprayed like crazy with pesticides, so it has high glyphosate content, and glyphosate could be a potentially an autoimmune trigger. And then things like just eating processed food. These processed foods contains many chemicals that can also be pro-inflammatory and trigger inflammation. So these are different things that we got to look at the diet. That's why eating clean and getting rid of allergenic or sensitive food is really the first step. Lifestyle-wise, we got to address sedentary lifestyle. If you just sit on your butt and do nothing, it's not good for it. It's not good for anything, but especially for autoimmune. But then also, if you overtrain, it's also not good for it, right? If you sit on your butt, no good. If you overtrain, right, you get overzealous, you go to the gym 3 times a day, it's going to be a problem, right? Now, I'm just kidding about 3 times a day. You don't have to go to the gym 3 times a day. But if you work out every single day very heavily, high intensity weight training, and on top of that, you do CrossFit, and on top of that, you do high intensity interval training, I mean, you may be doing too much. Okay? It doesn't take that much. Especially if you have Hashimoto's, you can overtrain with very little. Okay? Your threshold may be diminished. So what you used to think you were able to do, you can't do now. Smoking can definitely be a lifestyle trigger. Alcohol. Okay? Drug use. And when I say drug use, that could be recreational drug, but could also be prescription drugs. Many prescription medication interfere with thyroid function. Okay? Stress and unhealthy relationships, where it's abusive or just, don't get along, different mindset, different, alignments of values not there. That can be all very stressful. These can be lifestyle triggers. Chemicals, it's about toxins. So we have heavy metals as toxins. So obviously this could be like your mercury, lead, aluminum, arsenic, and many others, heavy metals. Okay, but it can be also non-metal toxins. So this could be things like BPA, phthalates. These are things you find in plastic compounds. It could be your pesticides. It could be a fire retardant material. Boy, you name it, I have found them. Because I actually look. We actually test these things. We test for these things. We find out. Right? You test, you know. Test, don't guess. The last thing is microbes. So these are various different types of infections. This could be bacteria, viruses. Boy, there's a lot of viruses that could be lurking. And I'm not just talking about COVID. I'm talking about chronic viruses like Epstein-Barr, Candida, parasites, not to mention mold. Very common. So again, we test for these things based on your history and your health concerns. So we make correlations. So we're not guessing. Even when we're not testing every test under the sun. We're testing what's the highest probability. So even the test is targeted, right? So that's important. So this is the proper management of Hashimoto. Now, there seems like there's a lot of stuff that I just listed out. There is. That's why you need to work with an expert that has the experience of helping people doing this, because I have a roadmap that I navigate this so that we know what to do first, what to do second, what to do third. So if you need help, please consult with us. We help people through virtual consultation. Been doing this for the past 100% virtual past 2 years. So when we're old hat at it, we have our structure set up, very efficient. And you can schedule a virtual consultation with us where we can order these lab tests. We can do these tests where you are at home. We can identify the root cause and then come up with a plan that will help you to peel off these layers of the onion and help you get better. So you can schedule these, first, schedule a 15-minute discovery call with our team. It's a free 15-minute call to see if you're a good candidate for our program and learn what our program's about. You can go to askdrkhan.com/get started. So go to askdrkhan.com ask.com/get-started. Go to that website, and you're able to request a 15-minute discovery call. Now, even just talking to my team is tremendously helpful. They're so well-trained, compassionate, understanding, and actually listen that they're going to be able to point you in the right direction. If it's us, great. Let's sit down and work together. If it's not us, they'll tell you how you can get help from other places. So go ahead and go to askdrkhan.com/get started. That's where you want to go to get started with this healing process, with this method that I've developed over the past, 12 years. It's taken a long time, but we got this code cracked, so to speak. Okay, so go ahead and visit that. If you are not following us on Facebook, please follow us on Facebook at Hope Integrative Wellness, and also follow us on YouTube at PeterConDC. A lot of free content, free information just like this to help you get clarity so you know what you're fixing. The number one problem people have with chronic conditions, they're fixing the wrong things. Fix the right problem. Address the root cause. This is a framework. Hopefully this helps you. Please like and share this video with as many people as possible. Subscribe to our YouTube and Facebook pages. And I look forward to seeing you next week at the Ask Dr. Khan Show. Take care.